Hello, and welcome to the second session of the Iowa Public Health Leadership Academy. To those of you that were with us for session one, we thank you for joining us again this evening. And for those of you that are new to the Academy, we want to welcome you. And thank you for taking the time to participate in the Academy. My name is Lori Walkner, and I'm the Interim Director of the Institute for Public Health Practice. This is session 2 of session 6, and tonight's session will cover local governance topics for boards of health in Iowa, with local perspectives from 3 public health professionals across the state. These sessions are designed to build on the content from previous sessions. So if you miss the first session, you can view it by accessing the Iowa Public Health Leadership Academy website at iowaphla.com. And as a reminder, we'll continue to meet every 7th Monday to go deeper into Iowa's public health system, with our next session taking place on February 24th. And that session will be on public health law. So before I turn it over to today's speakers, just a few brief comments. All participants right now are muted during the webinar. But during the session and subsequent sessions, we built in time for questions and answers throughout the session to help facilitate meaningful discussions and clarify content presented. This was actually a suggestion that came from all of you that was provided on the evaluation from the last session. So if you'd like to ask a question, you can raise your hand by going to the bottom of the screen, and you'll see it'll say participants. If you click on that, there'll be a small screen that'll come up, and you can click on the raise your hand button, and we can get to you and get your question at that time. If you experience any technical difficulties throughout the call, please use the chat box feature at the bottom for support, and please select to send your message to Hannah Schultz, and this will prevent it from going out to everyone. So today we're recording this session, and we'll make the presentation available to everyone that's enrolled in our academy on our website. We'll send out a follow-up email to let you know when that is ready and it's been posted. In addition, the presentations, a list of topics discussed during the questions and answers portion of the webinar will also be made available to public health administrators and the planning committee and regional public health consultants. This actually protects the privacy of individuals that participate in any educational offerings and is in accordance with the Family Educational Rights and Privacy Act, also known as FERPA. The slides and resource material from today will be shared with everyone and posted, as I said, on our website. And an evaluation will be sent to you after today's session. We, again, value your input and your feedback and hope to improve each one of these sessions. So I'd like to briefly introduce our speakers for today. Our first speaker is Becky Nowacek, who is a community health consultant for the Iowa Department of Public Health in Region 6, and will be presenting today's content. Our three local governance perspectives will be coming from Dave Coach, who's the director of Johnson County Public Health, Kathy Preston, who's the administrator for Emmett County Public Health, and Jess Wagner, community health coordinator with Gunderson Palmer Lutheran Community Health. So again, I'm going to pass it over to Becky, and I thank you all for joining.
Okay, good evening. If you can switch to the next slide. As you can see here, this first slide goes over our learning goals for session 2. I think Lori covered this, but participants will be able to explain the structure and functions of local public health, identify resources and improve health in a community, and understand the importance of their role as a Board of Health and Board of Supervisor member. Objectives are to explain the local governance responsibilities of your Board of Health, identify action items to assure your Board of Health is meeting local governance expectations, and the differences between the responsibilities of county-based boards of health and health system-based or other boards of health. Next slide. As you know, Iowa's decentralized home rule state. Each local board of health has jurisdiction over the public health matters within the county. Our 99 county boards of health are charged with assessing the health needs in their county, determining health priorities, and deciding how to meet those needs. County boards of health can either employ staff or contract with other agencies. Boards of health either oversee the recognized local public health agency within the county or partner with a contracted agency and provide input on public health activities and services. In Iowa, we currently have 64 county-based agencies where the Board of Health is the governing entity and 35 health system-based agencies where the local Board of Health serves in an advisory capacity. Next slide. As described earlier, there are varying structures at the local level where the local boards of health work in different capacities. With a diverse group of participants in the Public Health Leadership Academy, we encourage you to ask questions as we go so that you can learn from one another. Tonight, you will have the opportunity to ask questions of Dave Coach with Johnson County Public Health, Kathy Preston, Emmett County Public Health, and Jess Wagner with Gunderson Palmer Lutheran Community Health in Fayette County. So let us get started on learning more about the similar responsibilities for boards of health across the state. Next slide. As discussed in session 1, boards of health's roles and responsibilities include assessment, assurance, and policy development, also known as the core public health functions. Two additional areas we will discuss tonight are operations and relationship building. Next slide. The first responsibility we are going to talk about is assessment. If you remember from our first session, assessment means the regular collection, analysis, interpretation, and communication of information about health conditions, risks, and assets in a community. Next slide. As a Board of Health member, it is important and beneficial to learn about public health topics and issues specific to your jurisdiction. This can be done by knowing about and understanding the programs and services provided within your jurisdiction, identifying any gaps and barriers to the residents of your county, and evaluating the effectiveness and impact of current programs and services. As a Board of Health member, one way to ensure that you are familiar with public health services and programs is to have local and state partners attend your meetings to share information and resources. In the last 12 months, have you had a community partner come to your Board of Health meeting and report out on outcomes? If not, we encourage you to invite local and state partners to an upcoming Board of Health meeting to share information and resources. Next slide. Part of understanding the public health issues in a county ties into one of the essential activities of a Board of Health, which is the development of a Community Health Needs Assessment and Health Improvement Plan, also referred to as China HIP. Next slide. As you recall, Community Health Needs Assessment and Health Improvement Plans are a fundamental element in statewide planning. China and HIP has more than a 20-year history in Iowa and represents local action to promote and protect the health of Iowans. Local boards of health are required to lead a community-wide discussion with stakeholders and residents about their community's health at least every 5 years. Many local boards of health have started partnering with their local nonprofit hospitals in their counties to lead these discussions every 3 years to help them meet their federal requirements. Once needs are identified, boards of health develop objectives and strategies to address those needs, which we call the Health Improvement Plan. Next slide. Talking about the role of community health assessment and health improvement plan is very timely, and the fact that many of our local public health agencies are in the middle of collecting data or have recently finished collecting their community health assessment data. Do you know the plans for your China HIP? Do you know what data has been collected and reviewed? An action step for our boards of health and even our boards of supervisor members is to ask about your county's plan for the 2020 to 2025 China HIP. Also, do you know if your China HIP is on a 3-year or a 5-year cycle? At this time, we will be talking with our local public health administrators and learn how their Board of Health is engaged with assessment. So first, Kathy, how do you evaluate and report on the services you provide and outcomes your department department achieves.
In Emmett County, we complete an agency evaluation annually. We compile data from our programs and report this out to our boards of health. This report is available for public if requested. And along with the agency evaluation, program-specific evaluations are completed by the staff that is a lead for the specific program. Program goals and outcomes are reviewed and updated annually. And we also send out customer satisfactions for some of our programs to get their feedback for the services that we provide.
Thank you, Kathy. Dave, how do you evaluate your agency and provide results to the Board of Health?
Yeah, thanks, Becky. There's a number of different ways that we do that. So every month we have program unit reports, and those program unit reports are different indicators based on some of the activities, day-to-day activities. So for instance, it could be the number of restaurants inspected, the number of immunizations, shots given, those types of things. And so we do that every month at our Board of Health. We're shifting that to a little bit more of a performance-based model in which we're developing logic models for every program, and those logic models then will have measurements that we will track and report to the Board of Health as well. We also have annual reports. We have employee satisfaction as well as customer satisfaction surveys that we share formally with the Board of Health. We also have local community partners come to our Board of Health meetings. Typically, we'll have about 6 per year that we'll have some of our community partners come in and report on their programs. We also monthly have program presentations internally on our own programs so that the Board of Health stays more up to date on what we're doing on a day-to-day basis. We also have quality improvement projects that we're updating the Board of Health, not every month, but as those projects continue to move forward. Our strategic plan also has, we have 5 priorities in our strategic plan that have identified measures that we will be reporting to the Board of Health. And then part of the Public Health Accreditation Board requirements in Domain 12 is to maintain capacity to engage the public health governing body. So for us, what this means is that once a year, I will take all of the actions that the Board of Health has acted upon and put those into a report format and report back to the Board of Health. So for instance, that can be the number of presentations given to them, the number of policies that they review and approve, the number of grant applications that we submit, the different types of interaction that they have with the community, and those types of things that will also do an evaluation on the Board of Health's actions.
Okay, thank you, Dave. And Jess, as a representative from a health system-based agency and with the Board of Health as your advisory council, could you provide us with what your evaluation process looks like?
System. We have our Board of Health as an advisory council. We bring different topics to them, or different topics are brought up in regards to what's occurring in the county, state, local government. And as our board of directors for the hospital approves the policies and changes. So we seek the advisory, the Board of Health as advisory of which direction we should go. And the board of directors usually does the policy changes for us. Mainly, we kind of go in the direction of the China HIP each year as we conduct that. We work closely with the hospital to see, as a hospital-based system, what their China HIP is. They do an every 3-year basis, and we do an every 5-year basis of the China HIP. Over the last couple of years, ours has been obesity, and we provide different tactics that we have been able to, at the time that we changed our China HIP, or at the China HIP came out as our results for impact on obesity. We looked at the different programs that how we served our county residents, and began to realign our programs to have more of a public health systems approach. And so a lot of our home care funding comes through our county funding, and then the local Board of Health funding grant that comes through public health systems change pillars that we currently use. And so with that, we look at our year-end report that gives us some guidance of, you know, the different programs that we have served in the direction that we've gone, but also to look at having that advisory council for the Board of Health and being able to align with the county needs, the hospital strategic plan, along with IDPH.
Since Jesse brought up the community health needs assessment, just one more quick question for each of you. In the process for your community health needs assessment, has your Board of Health members or even Board of Supervisors, have any of them been involved with some of those stakeholders or community meetings to gather that data or review the data? And Kathy, do you want to start?
We do involve our Board of Health in a lot of those stakeholder meetings. There are, I guess, a few of the Board of Supervisors that have also been involved throughout the years. But yes, we try to involve them, and obviously then we report out how we're coming on the community health needs assessment to our Board of Health, and also to our Board of Supervisors.
Thank you. Dave?
Yes, we do very similar to what Kathy is describing. In Johnson County, we have our Board of Health chair is on our steering committee for our China Hip, which we've rebranded as Healthy Joko. We also have one of the Board of Supervisors involved in our steering committee meetings. We collect all that information and feed it out to the steering committee as well as various community partners for feedback. So both the Board of Health and the Board of Supervisors are involved in reviewing the data, providing input and feedback on that entire process.
Thank you. And Jess?
Ours is kind of a similar combination of both of what their reactions were to that question,
Okay.
but also we like to add in that we, you know, look at our hospital China Hip as well, pull in some hospital key staff for our process as well that we've done in the past too.
Great, thank you. And so just to recap from our discussion for our audience, obviously all three of our agencies are very different in the area that they serve, and each agency and Board of Health evaluation reports will look different and the reporting styles will be different. But as you can hear from our discussions, is all kind of going around the same. They do the program evaluation, customer service, and they do report that back to the Board of Health for information to help that Board of Health make further decisions. So at this time, I want to be able to open up our lines for questions for any of our guest speakers related around assessment. So is there anybody that has any questions? You can raise your hand again. If you struggle with that, I believe the chat box is also available there.
I don't see anything coming in, Becky.
Okay, well, if you guys have questions, we'll have more time at the end as well, hopefully, to ask any questions that come up between now and then. So thank you.
Becky, can I jump in with one
Yes.
comment? If you have questions throughout before we get to the question period, you can send them to me via chat and I will just keep a running tally of those. And when we get to the discussion period, I'll bring them up.
Perfect, thank you. Next slide. Next is assurance. Assurance means that programs and interventions that maintain and improve health are carried out by encouragement, regulation, or direct action. This core function answers a number of questions such as, when we enforce health regulations, are we technically competent, fair, and effective? Are people in my state and community receiving the health service they need? Do we have a competent public health staff? How can we be sure that our staff stays current? Are we meeting the needs of the population we serve? Are we doing things right? Are we doing the right things? Next slide. Local boards of health assure the health of their community by encouraging actions by others, by requiring actions through regulations, or by directly providing the services. Some examples of this include impose and enforce quarantine and isolation, providing immunizations where no local provision exists for the service, issue orders to protect the public health from persons with communicable disease dangerous to public health. One resource that is available to local boards of health members is the Legal Authority of Local Boards of Health, a document that was created by Assistant Attorney General Heather Adams. If you do not have this document, a copy of it has been posted on the Public Health Leadership Academy website. So next we'll be looking at, for assurance, the competent workforce for our local public health agencies. So we'll start with Dave. Please tell us more about how Johnson County ensures a competent workforce is in place.
Absolutely. So several years ago, as part of our accreditation process, we also developed formally a workforce development plan. So we typically made it a point to ensure that our workforce was attending conferences and webinars and such, but the workforce development plan puts formality to that, as well as really puts the formal budgeting process to support that training as well. We surveyed our own employees to identify, based off of the core competencies, what some of the areas of need were for them personally and professionally to grow in their positions and to be able to provide high quality public health services to our community. We also, all of our job descriptions, the Board of Health will review job descriptions, new job descriptions, or job descriptions that have gone through major revisions. That's one of the functions of the Board of Health. We also have a formal evaluation process for all of our employees, and the Board of Health's responsibility then is to evaluate the director, myself. So I complete an evaluation and send that to the chair, and the chair then shares it with the other Board of Health members to receive feedback, and then meets with me one-on-one to go over my own professional development as well. So that's kind of a high level what we do at Johnson County to ensure our workforce is competent.
Okay. And Kathy, can you tell me more about how your Board of Health assures that a competent workforce is in place in Emmett County?
And ours is pretty similar, but in Emmett County, evaluations or performance reviews are completed on all staff, including myself as a public health administrator, and that's done annually. Job descriptions are reviewed and or updated as needed when we have evaluations. And obviously when we hire new employees, we also take a look at those job descriptions. All of our job descriptions are approved by the Board of Health. The administrator, I am evaluated by the Board of Health annually, and each board member is asked to complete our administrator's performance review form, and then the board chair then reviews the completed forms with me. We have as the administrator, I'm responsible for completion of the performance reviews on all of our other public health staff, and some are completed directly by the administrator as well as by some other staff supervisors. And then we also have environmental health that's right here in our agency. So I do her performance review because she's part of our agency. And again, we encourage lots of trainings and encourage our staff to attend conferences.
Great, thank you, Kathy. And Jess, please share how this is done in Fayette County.
So as a hospital-based system, my direct report is to hospital administration, and that is our director of outpatients and services, who also serves as our hospital administrator for public health. And so with that, my position is the coordinator who runs all of the different programs that we offer in public health for Fayette County and complete grant requirements. And we also, as far as training and competency, that goes through the hospital that oversees that for performance evaluations, additional training, offering and attending all of the trainings offered by IDPH and other grants that we hold for public health.
Okay, perfect. Anybody else want to share anything else? Okay, so just to recap, for those boards of health that serve as a governing body, so our county-based agencies, the Board of Health should supervise the public health administrator and the environmental health specialist if the environmental health specialist is employed by the Board of Health and obviously is a separate agency from public health agency. So therefore, the boards of health should be conducting an evaluation of the administrator and environmental health specialist, if appropriate, on an annual basis. And the county-based boards of health should also review and approve annual agency reports and department evaluations. So that's where that difference between the county-based and our hospital system agencies and the boards of health there is that those boards of health should really be reviewing those policies, approving them, and department evaluations, job descriptions, where with our hospital-based agencies where the Board of Health is acting as an advisory capacity, they do not have that role with the competent workforce or even approving some of those annual agency reports. Okay, so at this time, are there any questions on competent workforce or assurance?
Nothing's coming up, Becky.
Well, I do see that we have a comment that having the representatives from 2 different size counties and a hospital-based agency is very interesting and helpful. So thank you for that comment. Okay, next slide. The third responsibility is operations. And next slide. Since boards of health are contractors for many Iowa Department of Public Health grants, it is important that you understand what the expectation and deliverables are for each contract. Are there required meetings and/or trainings for staff, reports, claiming requirements, or other requirements as a contract holder? As a reminder, the Board of Health is responsible for assuring the completion of the agreed upon activities and deliverables of the contract. Unmet deliverables, not met by the staff, reflects poorly on the Board of Health. Along the same lines of contracts, be aware of the year-to-date spending for Board of Health contracts, revenue versus expenses. Being able to understand why revenues and/or expenses are low or high for the time frame being discussed is an important business aspect of the public health agency. Next slide. So talking a little bit about budget, Jess, would you please tell us about the budget process from the health system perspective?
So our budget process, about 3 years ago, we pretty much completely redid our structure of how we look at our funding that comes in. We work very closely with our regional coordinator, and even over the 3 years, we've had to make some tweaks and change things a little bit, but overall it's been going very well. We took a look at all of our different funds that we had coming in from our local board of supervisors and our local public health service funding, and so we worked with our regional coordinator to look at having the local public health service funding come for more of the public health pillars of the structure, and so in strategic planning for that. So right now, a lot of our local public health funding is used for public health systems development and environmental change, health education, collaborative relationships, and some of the immunization components as well. We also have a couple alternative plans that we've wrote through a community health wellness program and environmental change components with that. When we looked at our Board of Supervisors funding, we looked at restructuring that component to the services that touch our patients. And so that means we looked at majority of that funding goes to our sliding scale fee home care patients, whether it's nurse or aide services. Then we also have a Happy Feet program, other health promotion services. We also some education through CPR and a babysitting course, along with anything else that might come up in those components. So we've really restructured. It's been a major learning process for us, but we've been able to really focus these last 3 years on those environmental change components and more health and wellness and all policy. So that's been very beneficial to our agency to be able to see that and how we monitor and report and kind of adjust from year to year. We look at that budget, and the budget that we have is the funding that we have coming in, and the hospital helps support that as well, and reviewing that with our director of finance at the hospital as well.
Okay, just a follow-up question. As you guys went through your restructure, was your Board of Health involved with that restructure, since they do act as a advisory council, or was that more with the board of directors at the hospital?
It was with majority of all of them. The Board of Health was large capacity in that, of just looking at the different programs that we have to offer. We really looked at what other services, since we're a smaller county, our total population base is less than 20,000, and we're a rural community up in Northeast Iowa. And so looking at those services of, we have other entities that serve different capacities for other grants that come into our county. So we wanted to really make sure that we did not duplicate services, and instead kind of pull in that collaborative relationship component of really working with stakeholders that we have in our larger communities, but also of those regional and state stakeholders, so we can hopefully be able to utilize our funding a little bit more effectively and not duplicate the services that we have in our county or close by, or be able to provide as a resource to someone to refer either a patient or a resident to another service that is already available, but that we don't have to provide.
Okay. And I do see one question that I'll ask, since we're talking with Jess. How did you include your Board of Supervisors in the planning conversations for restructuring your funding?
With that, we reported with our annual budget, we bring that to the Board of Supervisors. We get a set amount of funding, and we also have a Board of Supervisor that serves on our Board of Health. So that conversation was throughout the whole entire process.
And for monitoring and reporting to your Board of Health, so when you take budgets to your boards of health, and you probably are just taking your specific grants through local, like Iowa Department of Public Health, your county tax allocation, kind of monitoring those certain fundings, not your overall hospital budget?
Correct, yes.
Okay. All right, thank you. And Dave, will you share with participants about your budget preparation and monitoring?
Yes, so our county finance department sends us forms in September to start the process, and as part of your resource packet, I've shared the timeline, and it's fairly, I mean, it's for internal use, and so we have all of the little steps just to keep all of the managers and myself on task as far as the timeline goes. But our budget is one of the more complicated budgets within the county, just because of all the different programs. We have over 40 programs with over 1,200 line items of individual budgets or budget line items. And so we work through that internally and then share the first draft with the Board of Health in October, and really give them kind of a high-level overview of the budget. I point out any areas that have significantly changed from the previous year. And sometimes that change is based off of a percentage, sometimes it's based off of a sheer number. And then they provide their feedback to me in October. We come back with the final budget in November, which they will vote on then. And then from that point, it goes to the Board of Supervisors, and I present the budget to them. And it's kind of the same way. We just kind of go over very high level those line items. And as far as the Board of Health's involvement, when I present to the Board of Supervisors, last year I presented a 3-year growth plan for our department, and we had some significant asks. There was 4 new positions that I was proposing to be funded. Some of them were from fees. Some of the funding would be coming from county tax dollars. Some of it was from grants as well. But during that presentation in front of the Board of Supervisors, then I had one Board of Health member there just to provide support and to answer any questions that the Board of Supervisors may have had. And as far as the monitoring, every quarter we send out the full financial report to the Board of Health and then discuss any feedback or questions that they might have. We also, as far as our policy goes for the budget, anything that's over $3,000 that was not formally in the budget that they've approved goes to the Board of Health then for further discussion and approval. So if we have, for instance, a $10,000 purchase, but it was already discussed and in our budget, then I don't bring that in front of the Board of Health. But if there is something new that came up that we had not discussed or was not in the original budget, then that gets put on the agenda for the Board of Health and discussed. We also have decision packets in that budget process that would identify any capital improvements, any new vehicles, for instance. Also, any new positions that we're proposing would be part of that decision packet. And then the other aspect of the monitoring, like I said, is just the quarterly reports. That also includes, we also have a fall and spring budget amendment. And I think many counties probably do this as well, but we oftentimes will receive grant funding that we weren't planning on since we're building the budget 18 months in advance. There's a lot of unknowns. So twice a year in the spring and fall, we have budget amendments that we take to the Board of Health as well and indicate where new funding is coming from and where that funding will be spent.
Okay, thank you, Dave. And Kathy, please tell us a little about your process.
It's much the same as his, as far as we get the forms and the budget information from the auditor. We start looking at that in November, try to start filling that out. By December, we do have the budget completed, and we look at it with the Board of Health for any discussion, and then we do get approval from them on our budget. We do review our current budget and evaluate any known additional expenses for programming and personnel costs, and that's kind of done throughout the year. Once the Board of Health has approved our budget for the following year, we do also take it to the Board of Supervisors for their review after we have approval from our Board of Health. We do get their input on that. Obviously, they are the funder for part of our budget also. Our funding streams include grants, and currently we have like the immunization grant, local public health services, lead. We have a HRSA grant currently, and then ECI. We also do have some funding that comes in from Medicaid and private insurances. And then again, also we are supported by county tax dollars. And a financial report, we do give that to the Board of Health at every meeting, and it allows for our Board of Health to monitor our budget and how we're doing on that at every meeting.
Okay, perfect.
We too have budget amendments, as Dave said.
Okay. So the key takeaway for the budget topic is that the Board of Health that serve as advisory capacity will identify the use of those predetermined tax allocations from the county, while the Board of Health that are with the governing body will set and approve the annual health budget and monitor the use of those public health funds. So looking at those overall expenses and revenues. So obviously, as you can see, there's differences between the hospital-based agencies and what those Board of Health review. The Boards of Health are really looking at those grant dollars, the county dollars, keeping an eye on those since they are the contractor. And then the county-based Boards of Health are really looking at the overall expenses and revenues in the budget there. So at this time, are there questions regarding budget for our guests?
We do have one question by chat. It says, being new on the Board of Health, does IDPH have a standard form to evaluate employees or the administrator so as not to inadvertently ask inappropriate evaluation questions during the review?
So we do, I mean, as a community health consultant, and I know we have a couple other community health consultants, I usually ask for examples from other counties on what their boards of health use for their administrator, and then I share those. I don't think we have a standard one out there. I don't know if anybody else wants to chime in from our Bureau of Public Health Performance. So there also are some examples in the local Board of Health toolkit that's available online. So as a new Board of Health member, you can contact your community health consultant. You can also go to our website, and we can share that link later so that I don't have to ramble it out. But I usually ask for examples from other agencies and share that so they can kind of choose which one's going to, or adapt it to what's going to work best for their agency. Any questions about budgets? I know many of you, all of you have been working hard or have worked hard on the budget for the last few months. So thank you for all that time that it takes to do that. Again, if you come along with a question, please jot it down, send it to Hannah, and we can address it later on too. Next slide. Policy development is the implementation and evaluation of plans and policies for public health in general and priority health needs in particular, in a manner that incorporates scientific information and community values in accordance with the state public health policy. Next slide. A responsibility of the local boards of health is to stay informed of important public health issues, which we discussed earlier, and take the lead in public health policy development. One way for boards of health to take the lead in policy development is to ensure that your county has developed objectives and strategies to address the identified priorities and needs in your community. Be sure to ask about your current health improvement plan for your county. Next slide. Okay, so talking about policy development, and we'll start with Dave. Please tell us more about how your Board of Health is involved in the development, review, and approval of policies in Johnson County.
Sure, and I think this is in an interesting area that may vary significantly from county to county. Just because I've had some experience with various boards of health and know that they all operate a little bit differently and operate at somewhat different comfort level. But certainly in Johnson County, the Board of Health has responsibilities, obviously, over many of those regulations and ordinances, the isolation and quarantine, the wastewater regulations, those types of things that we absolutely will work with our Board of Health and work with the county attorney. But I also take any significant operational policy to them. So for instance, when we were working through our accreditation process several years ago, formally, we had a community health needs assessment health improvement plan, but we did not have a formal workforce development plan. We did not have a formal performance management or quality improvement plan or an ethics policy. So those major and significant policies we provided to the Board of Health. Typically, myself or staff would develop those policies, those draft policies, then we would send them 2 weeks before our Board of Health meeting so that they had time to review and formulate any questions that they may have so that we could have that discussion at the Board of Health. Then they would either vote on that policy or send it back to staff for revisions, and then we would bring it back the following month with the feedback that they provided to us. So they certainly have input in that type of policy development. Financial policies as well, I typically will take to the Board of Health. Many of the less significant operational policies, I do not take to the Board of Health. They have provided feedback that they do not want to be involved in the minor day-to-day operations of the department. And so I think, again, it just kind of goes back a little bit to the level of involvement that each Board of Health would like to have. But certainly, like on the wastewater updated regulations right now, our staff have provided a first draft to our county attorney. After that point, we'll take it to the Board of Health, then we'll go to the Board of Supervisors, then it'll go back to the Board of Health for public comment, and then finally back again to the Board of Supervisors for their 3 readings. So that's kind of how we work through our policy development and how the Board of Health is involved in Johnson County.
Okay, and then just a follow-up question, Dave, since we talked a little bit about the health improvement plan. I know in the assessment piece, we talked about having the Board of Health involved in that assessment piece of it, but do you then bring your health improvements, objectives, strategies, and kind of your outcomes where you're at, impact that you're making towards those strategies back to the Board of Health?
Yeah, absolutely, Becky. Yes, that's a good point. They were very involved in the development of that plan, not only from the steering committee, but once the steering committee kind of made their recommendations, provided feedback, we took all of that information to the full Board of Health for their review and formal adoption as well. And out of that health improvement plan, I don't know as if there's new policies that have been developed. I can't think of any right off the top of my head, but certainly a strategic direction that the department has taken based off the health improvement plan and based off of our strategic plan, and the Board of Health is very involved in that. When we just recently went through our strategic plan this past summer, we had 2 Board of Health members that were directly involved in those meetings that we worked through. New values, new mission, vision, all of that was presented to them, and they formally approved that as well.
Okay, great. Thanks, Dave. Next, Kathy, is this similar to Emmett County's process? And if different, please share how policy development is done in Emmett County.
It is similar. I think we have probably, our Board of Health actually approves some of the, you talked about maybe the day-to-day stuff that you don't so much in your county, but we do in ours. Our Board of Health reviews our policies and we have discussion on them, and then they either approve or have us kind of go back to the drawing board. But initially, the policies are developed with input from our staff. And then, you know, depending on what the program is, if there's a new program, it's a little bit more involved. But again, it's similar to him that we do take it to the board. They do approve all of that. And then we do have those either, you know, try to get those done annually if they need to be, and, you know, reviewed is one thing, but then, you know, if it needs to be updated, then they obviously would vote on those.
Thank you. And Jess, please share with the participants what the policy development process looks like within a health system-based agency.
So as far as ours, it's that advisory role capacity. A lot of the times we will make sure that they are informed of policy changes. We like to bring different policy changes to the Board of Health for suggestion, and just being able to talk through and have further discussion with them as far as what they're hearing in the communities, how they better feel that it would serve the residents of Fayette County. And ultimately, the hospital's board of directors are the ones that approve the policies and the changes. So at our agency, we follow the hospital policies. So a lot of our hospital policies govern like our HR, our other policies that we do. But then we also have a few separate public health policies that are specific to our public health programs, and in addition to like our standing orders. We receive a lot of input from either our compliance officer or marketing director on different programs. It kind of just depends on which policy we're looking at either changing. Our policies are reviewed annually by our board of directors, and changes are brought both to the Board of Health as far as advisory, and then it is approved by the board of directors of the hospital.
Great, thank you. And for Dave and Kathy, are your policies reviewed annually, or do you have kind of a schedule of when certain policies are reviewed, need to be updated?
Yes, we do review them annually. We have kind of that built into each policy, especially the significant ones we have built right into the policy itself, how frequently it will be reviewed.
And that's the same for us.
Okay, great. So again, just covering kind of similarities, differences. One thing that we really want everybody to kind of take away from the policy development that's different between those county-based agencies and our health system-based agencies is that where the local Board of Health are the governing body, the Board of Health should be reviewing and improving agency policies and really identifying services provided by recognized local public health agencies within their county. So it's really important to have that boards of health members know that they are responsible for reviewing those policies. Like Dave said, for them, their Board of Health, the smaller day-to-day tasks is not something they feel that they need to be reviewing and approving, but some of those larger operational policies do. So at this time, I would like to open it up for questions.
We do have one question by chat about grants. So how is the availability of new grants communicated to local public health agencies? And do some local health agencies utilize the help of grant writers?
So I would say, especially from Iowa Department of Public Health, many times, depending on which program area the grants are coming from, there's a listserv that those are sent out from. Otherwise, iowagrants.gov has a listing of grants that are available throughout the state. I'm kind of drawing a blank on others. I don't know, Dave, Kathy, or Jess, if you want to provide input on maybe other places you have looked and received grants, and if you guys utilize grant writers to assist in that process. So Jess, would you like to start?
Yeah, as far as additional grants that we look at local partners, either state, regional, or local partners to see if there's grants that are utilized or that are available for us to apply for to help with some of our programming. We also look for cost share programs as far as marketing and things like that. With that, no, we do not utilize grant writers. I assist in writing different grants. We also have our public health information officer review anything that goes out for grant writing or publicity. We also have some regional partners that review any grant applications, and we really rely on our stakeholders, maybe it's that are involved in the grant that we're writing, to help review that prior to us submitting that.
Great. And Kathy?
We are obviously a smaller agency, and we oftentimes are partnering with other either counties, or we say like the lead grant. There's 4 counties that we are the lead for it, but we share in doing those grants. We do that together. Or if there's local partners within the community, say the hospital, our HRSA grant that we're working on right now is a planning grant with the hospital. So when we do those, obviously the hospital has grant writers, so that's very beneficial to us also. But when it's specifically from our agency that we are writing grants, we do not have a grant writer here. We usually, try to do those ourselves. Sometimes we're successful and sometimes not so much, but we do try to reach out and see what kind of grants are available. Diane is our regional nurse consultant, and she is very good about, if she sees anything, she's forwarding it on to us in an email in our region, as I'm sure that's the same in all the other regions too. But then we also, there's some emails that we get from different entities that may let us know of any grant opportunities that might be out there.
Thank you, Kathy. And Dave?
Yeah, very similar to both Jess and Kathy. We also look for private funding, but we partner a lot with community partners throughout the region here. One thing that I did want to mention that kind of ties together that the listeners, just to be aware of, is the community health needs assessment that we all do provides a lot of local data, and we have local partners oftentimes either calling us or referring to our community health needs assessment as data that they can use in grant writing. So I would just put that out there as well, for just to be aware that that's just another great use of the China, and that you can use that kind of as a health department to create those partnerships as well in the community.
Great, thank you. Next slide. Although there may be more responsibilities for the local boards of health, the final one that we will discuss is relationship building. Next slide. Local boards of health are autonomous from the Board of Supervisors, but it is important to have a good working relationship with the boards of supervisors. After all, the Board of Supervisors have authority over the local Board of Health in 3 areas: appointment of Board of Health members, approval of adopted rules and regulations of the Board of Health, and appropriation of county tax funds that the Board of Health uses for its operation. If you have not attended a Board of Supervisor meeting, we encourage you to try and attend a meeting with your public health administrator. This could include meetings where the public health agency is discussing their annual funding request, where public health staff are sharing information, or when there are issues that arise. Next slide. There may be issues that arise where you will need the assistance from an attorney for guidance. Some examples include the review of contracts, appeals, or when enforcing county and state laws. As a Board of Health member, you have the county attorney available to you to provide guidance. Some of our local boards of health are fortunate to have representation from the county attorney's office at their meetings and providing guidance, while others do not have this regular presence. One way to build a relationship with your county attorney is to invite them to one or more of your Board of Health meetings so that they become more familiar with the public health in your county. Next slide. And of course, it is important to maintain a relationship with your public health administrator. This can be done through being prepared for the Board of Health meetings by reviewing the Board of Health packets, if mailed beforehand. We understand that that may not always be the case. Being present and engaged at the Board of Health meetings and asking appropriate questions, expressing concerns, and or sharing suggestions. It is important to communicate openly with your administrator. For our final discussion topic, I would like to hear from each of our guests on how they work with other county departments and leaders. Kathy, as a representative from a rural county, would you share how you work with other county departments and leaders?
We work actually really well with our other county departments and leaders in Emmett County because we are a really small, and our department is small, but also the other county departments are small as well. So we literally know almost everybody that works in Emmett County. So like our county attorney, for one, she's literally a phone call away for any questions or advice on contracts that we might have or any other documents that we have questions on. And we have worked with her on ordinances and other projects in the county. We work closely with our county auditor for any HR and personnel or budget issues. Because we are a small county, we don't actually have an HR department, so a lot of that falls on the auditor's department. So we are in pretty close contact with them also. Our public health fiscal person prepares invoices with documentation and sends that up to the auditor's office for review. And then this is sent and reviewed and approved by the Board of Supervisors for payment. So, there's all these inner workings that we obviously are working with all of the departments there. We do attend some of the Board of Health or Board of Supervisors meetings, especially if there's an agenda meeting that might pertain more to public health, or if we might be able to provide some public health input on some of the other county issues. The Board of Supervisors does manage the funding distribution for our county, so we do review our Board of Health approved budget with them. They do also provide, they provide the building that we're in, and along with any improvements to our building, so that makes us in pretty close contact on that kind of thing too. So we keep them informed, obviously, of our current programs, along with any plans of increasing or eliminating any of our programs. And you know, we feel that it's really important for our staff to also know what's going on with the Board of Supervisors. So I always make sure that we have the minutes from the Board of Supervisors meetings for our staff so that everybody's kind of up to date on what's going on. And that's the same as with our Board of Health minutes as well. We also work with a lot of the other departments and elected officials as needed. But again, you know, we are a small county, so it's almost as easy as picking up the phone to communicate with them with whatever needs we might have.
Great. Thank you, Kathy. Dave, would you mind providing us with an overview on how Johnson County Board of Health and Public Health works with Johnson County Attorney, Auditor, Board of Supervisor, and elected representatives?
Yes, absolutely. So we are fortunate to have a county attorney present at each one of our Board of Health meetings. And it does really come in very handy numerous times if, excuse me, if the Board of Health members are wanting to kind of diverge a little bit and talk about something that's not on the agenda, then the county attorney will politely remind us that we just need to stop the discussion and put it on a future agenda item. The board is very involved with them, as I said earlier, when we're talking about wastewater regulations or quarantine and isolation regulations, those such things. As far as the interaction with the Board of Supervisors, we do have joint meetings with them once a year. Obviously, the budgeting process is very involved with them. The Board of Supervisors, along with the Board of Health, are involved in the hiring process for the director position when that comes up. The Board of Health will also attend with me to many of the Board of Supervisors meeting if we're receiving an award or there's a proclamation being read. Oftentimes, I'll make sure that the Board of Health know when those dates are, and oftentimes we'll have one or two attend in that respect as well. As far as the elected officials that I meet with regularly in Johnson County, outside of the Board of Supervisors, so our state elected officials, I typically will make those appointments available to the Board of Health to attend, as long as we don't have more than two of them attending with me. So they stay involved with the elected officials in that way as well. I think there's something else I was going to mention. I can't think of it right now, but for right now, that's it.
I have a follow-up question, Dave, for you before we move on to Jess, because I know in the past, I think many of our community health consultants have been asked about joint meetings with the Board of Supervisors and kind of how that works and how that looks like. So I don't know if you can share a little bit more about your Board of Health and Board of Supervisor joint meetings and maybe what the agenda looks like, what you discuss.
Mm-hmm. No, that's a great point. Actually, that reminded me of what I forgot. So also once a month, there is a Board of Supervisor that is appointed to each county department. And so there's one Board of Supervisor liaison that I meet with monthly to really kind of go over not only what was discussed at the Board of Health, but any just operational items that the Board of Supervisors should also know that happens within our public health department. And so he and I work then oftentimes on developing that agenda for a joint meeting along with the chair for the Board of Health. That kind of goes back and forth and is iterative as people identify different areas. But typically what we'll do is we'll pick one or two really large items to discuss. And so oftentimes that would be the community health needs assessment, health improvement plan. It might be a major restructure of our department. Those types of things are typically what would encompass an agenda for a joint meeting.
Okay, thank you. And last but not least, Jess, would you share from a health system-based perspective on relationships with county departments and leaders?
So with us, it depends on the agency where they're located. We are currently located at the hospital. We have a separate building with our home care department and community health and HME departments in it right across from the hospital. So the hospital provides the building and our local resources as far as HR, utilization review, those type of things. So our relationships with Board of Supervisors is that annual budget with the county dollars, how that intends to be used. We also have a Board of Health member, Board of Supervisors member serve on our Board of Health. So that Board of Supervisor is at every meeting, and that allows that communication to flow from there and that expertise at each meeting for Board of Supervisors. Like Kathy, we are a small county, so just to be able to pick up the phone and have personal department cell phone numbers. That's how we operate. Work very closely with our county EMA on preparedness and pulling in those local partners, whether it's the hospitals, nursing homes, assisted living. And then also a lot of the programs that we utilize, not only just county-wise, but we utilize a lot of the departments in the hospital to help us with our programs. For an example, our community wellness program is utilized through our cardiac rehab program, so staff help with that. And then also too, we pull other staff from the hospital to assist with immunization clinics, immunization card audits and such. So really being able to have to additionally work with the local hospital, since we're a hospital-based agency, which is allows us to have a very small department, but have a lot of capacity on different things that we can be able to offer, whether it's through the hospital to serve the county or for the local public health funding, or also the county funding and the residents that we serve. We also have an office down in the southern part of our county. We have an Owine office, so we offer services down in that community as well, as far as an office setting, and having some clinics in that area too. So we technically have two offices in a smaller county, but geographically they're quite a distance away.
Okay, thank you. And I think just kind of jumping in here and kind of bringing things together before we go to the next piece of it. I thought it was really something important that just everybody's really said. So when we talk about the community health needs assessment, and we have this slide, we're talking about working with county departments and leaders. I think one important thing that I would like you guys to maybe provide a little bit of guidance on too is when you guys come up with your priorities for your Board of Health, or you guys for your health improvement plan, are you going out and doing all of the work that is identified based off the assessment? Or are you working with community partners in your county to go ahead and move forward to address those priority needs? Because I know right here we have working with county departments and leaders, and I think it's one step further in working with the community at large. So if you could share a little bit about maybe the implementation of your health improvement plan by working with other community organizations and leaders. And hopefully that makes sense. Whoever would like to start, I'm okay with.
This is Jess. I can kind of give an example that might help kind of at the local level for some boards of supervisor, Board of Health members to understand. With our community wellness program, which is an alternative plan for our local public health funding, we've been able to utilize a wellness program for health coaching through our cardiac rehab program with exercise, nutrition, and mind well-being. Since we've started that program, we also identified the need to increase the nutrition education in our county and for our residents. And so through that, we've developed a community teaching kitchen that's mobile, and we've partnered heavily with community and county stakeholders, with ISU Extension, with our local fair board, and other locations and coalitions within our county to be able to host those classes and assist with getting people to those classes that they feel are needed at that. So with that China Hip, that's really helping us, at the very, very local level, addressing the education components that go into obesity, and then also looking at environmental change components with working with local city government on, sidewalk infrastructure, safe routes to school, with different walk audits that we've been able to provide, and kind of looking at the overall walkability and infrastructure changes of communities and how that impacts our overall health of just being able to change that environment has the opportunity to change someone's health and health outcomes.
Great, thank you, Jess. Dave or Kathy?
Yes, I can go next here and just kind of give you an overview. So our health improvement plan, this 5-year cycle, has identified 17 priorities. And so when you talk about the health department doing all of the work, there's absolutely no way that we would have the capacity to do that. So one of our primary functions is really to be that collaborator and to be that convener of our community partners that are involved in those 17 priorities. We certainly have internal staff that take the lead on some of these areas. We also participate and are involved in a lot of different community coalitions. So part of the responsibility of the Board of Health is just to assure that a lot of these services are being provided and that a lot of these identified health priorities are being addressed. And so we take that responsibility and try to be that convener and try to be that neutral entity that can pull different partners together to talk about things that traditionally may not be as close to public health as what we think. So for instance, we do a lot of work convening partners on affordable housing, transportation issues and things like that. And so we absolutely use our health improvement plan, which I mentioned earlier. We rebranded our China Hip into the Healthy Joko. And part of that is we've developed a website to provide a platform for our community partners to share what's going on from their work, to post questions, to be able to easily access the data that we've collected and analyzed. And so that's kind of the direction that we've taken with our health improvement plan.
Thank you, Dave. And Kathy, anything else you would like to add?
We too work very closely. We have a really good working relationship with our local hospital here, and we work very, very closely with them in doing our community health needs assessment along with our health improvement plan. Obviously, we are a small agency. We have limited staff, but with the partnerships that we have within our community, we can make a difference. The limited resources that we have, but if we combine, we obviously can make a bigger impact in our communities. So we work very closely with other entities within the community. We do have a wellness coalition that some of our strategies are run through there also, but it's a good way to get all of our partners together and try to work on just improving the community, and whether it's through other strategies beyond the health improvement plan. But yes, we obviously couldn't do it on our own, and we have great partners that help us with that.
Great, thank you. So at this time, I would like to open it up for any questions regarding working with county departments, leaders, and other community organizations.
We've got one by chat.
Okay.
Do Board of Supervisor representatives to boards of health generally volunteer for that position because of an interest, or is it more of a random assignment by the Board of Supervisors?
I think, and this is just me from my personal, sometimes it's a mixed. Sometimes, depending on the county, there is an application process. So it's posted and people can submit applications to be on the Board of Health. So it's of an interest. I think others, maybe some boards of health supervisor members have someone in mind and invite them to apply for, to be a Board of Health member. So I don't know if you guys can share a little bit about the process for how your boards of health are appointed and what that process looks like.
This is Jess. For our Board of Health appointments, they go through the supervisors. We do have an application process, and the Board of Supervisors also asks for us to review the applications and a recommendation to come from us as well. And then ultimately the Board of Supervisors appoints that member.
Anybody else?
Yeah, the process in Johnson County is very similar to what Jess just described. Oftentimes when we have a member that their term is up and they reapply, we'll have supervisors, Board of Supervisors kind of reach out to myself and just ask some general questions if they're engaged and involved in meetings and are, add value to the meetings and things like that. So yeah, and also in Johnson County, we have several individuals in the community that have a passion and interest for public health, and so when we do have open positions, we have typically several applications for that spot.
So,
In
oh, sorry, go ahead.
I was just going to say in Emmett County, I don't believe there is not an application process. So they try to reach out to people that might be interested in public health or wellness or health in the community in general. So that's kind of how they go about it in our county.
I understood this question a little bit differently. So the way I understood it is for Board of Supervisors, for supervisors who are also on the Board of Health. Was that due to interest, or was it an appointment by random assignment from the Board of Supervisors?
For us in Fayette County, our current Board of Supervisor that's on for the Board of Health has been on for a very long time. So that consistency is very beneficial as far as when it comes to the education of that Board of Supervisor member. That's been very beneficial to us, and usually interest in that's been appointed long time ago.
We do not have a Board of Supervisor that is on our Board of Health.
We do not either in Johnson County, but as I mentioned earlier, we do have one of the Board of Supervisors that is the liaison to public health that I meet with monthly, and that is an appointed, so the 5 Board of Supervisors at the beginning of each year, actually in January, will look at all the county departments. Typically, they're assigned for 2 years to a county department, and then they just, amongst the 5 of them, they determine who is appointed or is the liaison to, like the Board of Health. It's the same way with the Veterans Board and Conservation Board.
So for Board of Supervisors, as a Board of Health member, she would say most times it is an internal appointment from within the Board of Supervisors themselves. So in thinking about the counties that I work with, the ones that do have a Board of Supervisor on their Board of Health, it's usually just a internal process between the Board of Supervisors who will be serving as a Board of Health member. So hopefully that answers the question. I think we answered it 2 different ways. So, okay, next slide. Okay, so this is a question that we would like participation from all of you guys. So for our Board of Health members, of the responsibilities mentioned, which are you currently doing? So those action items that had the little check box at the bottom, what are you currently doing as Board of Health members?
Wellness, participating in China HIP and reviewing policy. Someone else said all parts equally. Have been to a Board of Supervisor meeting. Community assessment, wellness. Budgeting and relationship building. Assessment, assurance, operations, relationship building, a wellness coalition. Attend all meetings and sign where an MD signature is required. Finance committee. On the wellness committee, involved with the needs assessment, community education, attend all meetings, budgeting, review policies, monthly budget review, all that was presented.
Okay. Thank you all for see. I have.
Needs assessment, budget review, evaluation of director.
Okay, well, for all of you that are participating, do you see if there's is there an opportunity for improvement in ideas and actions that are shared today? So is there anything that can be improved upon for these action items that we shared today? And we'll have a little assignment for you guys to think about over the next couple months. So next question for you all. Think about kind of, I'll give you a hint, but kind of my recaps and all of our discussions that we had with our guests. How are responsibilities different between boards of health that govern the recognized local public health agencies and those that do not? So again, in your chat box or raise a hand. Yes, I can repeat. So thinking about all of our discussions we had with our guests, how are responsibilities different between the boards of health that govern the recognized local public health agency and those that do not? So basically the differences between our county-based agencies and our hospital-based agencies. We had our panelists speak about how their agencies do something and the Board of Health go through assessment, assurance, policy development. And I did do kind of a recap too.
So we have a couple of answers here.
Okay.
We have one person saying there's a more active role for agencies that govern and more of an advisory role for those who do not. Someone else has said budgeting is different. Someone said boards of health for hospital-based agencies are advisory only. Another person is saying it's a matter of concern. Hospital-based agencies, their first concern is the hospital and the system.
Okay. Any last thoughts there? Okay, next slide. So in summary, we discussed some important roles and responsibilities for our local boards of health, ranging from the core public health functions to building relationships within your county. We hope that this session has not only given you an overview on similarities and differences of the boards of health across the state, but also provided you with steps you can take to be more engaged with public health in your county. As we conclude, I would like you to think back to the action items discussed and identify items that your Board of Health are doing and 1 or 2 action items that you would like to incorporate or improve upon over the next couple of months. With that said, do we have any further questions, comments?
We have a comment. I found this meeting to be very informative, and I really liked the format with 3 leaders from various settings.
That's all I have, so I'll turn it back over to Lori.
So thank you again, Becky, to your presentation and your questions, and Jess and Kathy and Dave for your panelists' approaches to these questions, and to all of you for participating in this session. All of you will receive an email once we have the archived version of the webinar posted, so you can access that along with all the resources that we've been talking about. Those resources are already posted for you. One resource that we're developing for you, and it's up there now, but we'll continue to add information to it. It's actually one that's called Action Items. It's entitled Action Items, and that's kind of a quick reference for you, and hopefully it'll become a tool that you'll want to refer back to, and you can quickly access information from these sessions. This session is filled with those questions that you want to make sure that you ask, the Board of Health members ask during their meetings. So we'll be just adding on to that, and hopefully that'll help you carry out your roles and responsibilities as well. We, again, appreciate all comments during the session and really look forward to having you fill out that evaluation so that we can assess it and make improvements in future sessions, which our next session is going to be on February 24th at 6 p.m. again on public health law. So again, thank you all for joining, and we hope you have a good evening. Thank you all.